Well, again, thanks for joining us on this afternoon, evening, early evening. Thanks for taking the time and for helping us out in determining what our priorities might be for the upcoming legislative session and also for Congress. As you know, employment has been a hot topic for the last couple years or more. And so I know that there's some topics that some of you want to talk about. My name is Carlin Crow, and I'm the Iowa Public Policy Manager with the Iowa DD Council. And with me today is Wendy Anderson, who's our Public Policy Committee Chairperson. Wendy, would you like to introduce yourself?
Yes, thank you, Carlin. I'm Wendy Anderson. I live in Trainer, Iowa, which is on the west part of the state. I'm a family advocate. I have three children, two with disabilities, one who is 17 and a half years old. So we're going to be entering into all the adult stuff too. So here pretty soon. So happy to be here. Thanks everyone for joining us.
And also on our Public Policy Committee and helping out today is Nicole Nospish. Nicole, do you want to introduce yourself? And we can get you pinned too.
Oh, Nicole, you have to unmute, hon.
Can you hear me?
Yes.
Okay. My name is Nicole Nospies, and I'm from Kerwick, and I am a self-advocate.
Thanks, Nicole. And Nicole's going to, in a little while, share a little bit about her advocacy work and working on the Work Without Worry legislation that we've been working on for a couple years. So um, we'll queue her up and get her ready to go here. But wanted first to talk a little bit about why we're here today. So first of all, we're doing a few of these sessions to cover different topics that we have. The way that we put together our public policy priorities is under, or we have for the last couple of years, has been under kind of four umbrella areas. And we had our first listening session last week on community inclusion in healthcare, and we talked about Medicaid a bit there. This time we're talking about employment, and again, know that that's a hot topic for many. And then in a few weeks, later in September, we'll uh, address special education, transition, and post-secondary. And we know that that's a hot topic too. So we wanted to space these out a little bit so we could uh, make sure we had the right people at the table and getting the input that we need. So that we're not doing these all on top of one another, each other. And we'll do those later in the evening. So September 21st at 6. And then October 5th, we'll have our final session on voting and civic engagement. And that's another one where we might want to talk a little bit about what's going on at the federal level, because we've got some issues there and some things might happen before then. So we hope that you will register for those also. And we'll also talk about other topics at each of these sessions where we don't want to be confined to those issues. We just thought this would help us give more focus to each session and make them maybe not go so long. So the plan for tonight, although we might vary from this a little bit, is to just let you know how we set up our priorities, what our priorities look like and focused on last year, um, how we, I'll say progress towards goals, but maybe it's more like, what really happened last year and the year before when we kind of set up priorities and then the legislature just goes in a whole different direction. So progress towards goals might even be an interesting way to report what we're working on. And then we'll talk about federal activities and how that's affecting states. This was very, there's a lot going on right now in the Medicaid arena, and that's having a a big effect on how um, advocacy organizations and also legislatures are considering their next go around as far as their general assemblies and election issues. So that's something to watch for also as we move into these um, varied topics, and each one of them is getting a lot of attention right now in Congress and with the administration and with federal departments. Um, and we're seeing some ways that things are kind of tying together. And so actually it's a little concerning, all that's going on at the federal level. And we're trying to make sure that we're obviously keeping an eye on it, but also looking at how we can respond as a state, and state policies can respond to what's happening federally. So that's more complicated than we will probably get into today. Um, but just want you to know that that's on our radar also. And we want to hear from you. And so when we did that session last week, we did a lot of talking, and then we kind of held everything at the end to have um, you all speak out. So we're going to stop a little bit in the middle here and hopefully get some more comment. We don't we don't have breakout rooms set up. We thought about that, but I think we're a pretty small enough group that we really want to hear everybody's thoughts and make it informal. But we do have a way of kind of hoping to get some feedback that I'll have Wendy share with you in a minute here too. So that's the plan. Just an overview of how we set up our priorities. This is more from a publication standpoint. This is what our publication looks like. We are having our priorities span, 2 years, because the Iowa General Assembly is a 2-year session. And so bills that are introduced the first year can be carried through to the second year. And we saw a lot of that last year. So the last Iowa General Assembly, we felt like we were repeating ourselves for putting together priorities 2 years in a row. So we're going to span these over 2 years and update them as necessary. And as mentioned, we break them out into goal sections, and then we talk about suggestions for policy, and then we define some terminology for legislators and also for advocates. And actually, these policies are put together for legislators, but they're also a way, obviously, for our advocates to know and other organizations to know what we're working on. But we keep in mind that they're designed for legislators and as an educational piece, and hopefully reviewing our suggestions will give them ideas for what to work on. And so I'm going to ask. We're going to start here with what our employment overall goal looked like last year, and I'm going to ask Nicole to review this. This is kind of the long overarching statement that we put in our at the top of our uh, page, for lack of a better way to describe it, for when we consider the employment alternative or policy alternatives. So, Nicole, would you mind taking it away and letting us know what this says?
Yes, Iowans with disabilities want to work and be financially independent, but barriers exist that force them to make impossible choices between employment and getting the support and care they need to live and work in the community, to keep the health care insurance and long long-term supports they need through Medicaid. A person's income and assets are kept. These limitations force people with disabilities to live in poverty, limit the hours they work, avoid mirrors and rely on public assistance programs.
Thank you, Nicole.
You are
So then we have called these in the past calls to action. And these are kind of our suggestions for what lawmakers could adopt and perhaps make policies around. And so I'm going to I'm not going to read these, but highlight each bullet point, and then we're going to give you a chance to respond and see what you what you think here. So, implementing employment first policies. The employment first comes up a lot when we're sometimes it's almost like more of a government term, right? It's what we would consider for people with disabilities who need assistance, who need public assistance, is that we are um, considering employment and the supports that they need as the first option for assistance rather than assistance that would place them in an institution or in rehab programs that aren't focused on employment. So in other words, we want the funding priorities to be towards employment. And this is a national initiative. It's been a program for um, many years. I don't know how many years, but many. Even when my son was in middle school, I heard about employment first. And the priority, and now he's in college. The priorities prioritize competitive integrated employment, which means employment in the community as anyone would have, and not in a sheltered workshop or something that's specifically for people with disabilities. So it's fully integrated employment in the community. So the second one here is really kind of you'll appreciate this language if you worked on the Work Without Worry bills last year. So removing Medicaid and supplemental security income income and asset limits for employed people with disabilities whose only option for health insurance and supports is Medicaid. Now, we focused on the Medicaid limitations, eligibility limitations on income and assets when we talked about Work Without Worry. SSI or any Social Security program would be a federal program. And those are also being considered at the federal level. And there has been policy introduced to address those limits also. But we in Iowa, our focus was on Medicaid because that's what we could make changes around here. We're not able to affect Social Security. So even though we put it in kind of one paragraph, it would be really two different policy initiatives. And so that's mostly what Work Without Worry focused on, including some other things. And if you're not familiar with Work Without Worry, I'll come back to that. So the third bullet point here is excluding assets such as retirement accounts and all of the types of accounts or types of programs that would fall under that, so that they don't count as in asset limitations. So allowing individuals to pay a premium based on their annual income to maintain Medicaid services is much like the MEPD program, but it would not exclusively be Medicaid for employed persons with disabilities or MEPD, that there could be other ways that people could keep Medicaid services and still be working, and perhaps not be under MEPD, which is limiting for some people. The last one here on the left is provide tax incentives to companies that hire, provide transportation to work, and allow work from home options for people with disabilities. I'm going to go to the next three on the next section. So funding voc rehab programs and programs under the Department for the Blind that focus on transition, because we can get a federal match for those, and we're not always optimizing our federal match. Investing in self-employment programs through voc rehab, which they already do to a small amount, and it has been cut back. And then investing in broadband and high speed internet so that more people with disabilities can work from home. So we're going to open it up to what you all might think of how these are both set up and what they're working on, what they're addressing. I'm going to catch up in the chat here, but any comments on what we have presented so far, or what, or even if you have come to this session and want to talk about something specific, please bring it up now if you'd like to. We're just going to open it up, or you can put it in the chat if you feel free. Oh, Marie has been active in the chat here. Thank you, Marie. Self-employment support and options as other options is a great idea. We hear the same, that more people would like assistance with setting up their own business, more people with disabilities. There are grant programs through Voc Rehab, and they they are funded, but we also hear that more people could be served. So yes, that's an area that we could consider more for more support. Anything else? We can move on, and then as you all are thinking, we got you now thinking about what we've worked on in the past. How we could either address these issues again or new ones. Yeah, transportation to work is an issue. That's why we kind of put it together as far as tax incentives for companies who hire people with disability. This is a tough one because lawmakers don't want to force employers to hire people with disabilities. But if we can provide some extra incentives to develop a workforce, then that's something that they listen to a little bit more. However, that still requires funding. And that's been our big barrier over the last couple of years. Okay, I'm gonna, let's see, go on to talking about what's been taking up most of our time. So I'm sure many of you know about the legislation called Work Without Worry. It was introduced 3 years ago by Representative Josh Turek, who, as many of you know, is a representative from the Council Bluffs area and district, who has spina bifida and uses a wheelchair, and has been a, a proponent of many disability policy changes in his last 4 years in the legislature, and now is trying to take his work to Congress. So he originally put together Work Without Worry to address the income and asset limits that people who are eligible for Medicaid and who are working are restricted by, and how much they can earn in order to keep their Medicaid. And it's been an uphill battle, sort of, to have get people to understand what this really means. And it made inroads, actually not as slowly as some bills do. But when we're talking about employment, you know, the legislature is interested because everybody wants everybody to work and be employed and pay taxes and be able to take care of themselves, so that we don't have to rely on the government or public assistance programs for people to be able to live in Iowa. So the limits that were originally proposed in Work Without Worry were unlimited limits. But what has changed in the past few years is a kind of a compromise that the income and what ultimately was worked on and got a little traction this year was increasing the threshold from 200 or actually it was considered to be 250% of poverty level, and then up to 350% or 300%, which was this was after the initial suggestions were made. So this does give a person who is eligible for MEPD um, some extra income, but it does not eliminate income as an eligibility limit, and that's what many people are looking for, because then you're still restricted to some extent. Not counting spouse's income and pensions, and then disregarding one car is what the bill looked like last year that passed out of the House and didn't make it very far in the Senate. And made it out of committee. So the the question now is, what do we work on next? And what we've heard is there are some legislators who want to go back to the original work without worry language and kind of start over. Um, However, the chair of the um, House Health and Human Services Committee wants to work on this again, as is for next year. And if his party is in the majority again, then we have some hope that it will come up. Um, but it may again need some more compromise, and that's usually to get it through the Senate, which is a little more tight in how they spend their money, because this is going to cost the state a little bit of money. What we're working on in order to try and convince legislators that this is an investment and not just um, a spending category is that the more that we can help people work and earn, the more that they will pay taxes, buy more things, increase revenue back into the state because they're not um, taking as much as they're giving. And that's what they want to hear. And that's why I kind of put it in those words. Um, so, what do you all think about this initiative and where should we go next? Or what might be some helpful ways that we can get this passed next year?
You can keep talking to your house and senators.
Yes, Nicole, and I'm going to ask you to tell us how you worked with your senator last year and your House member. Nicole was a very big advocate for this bill, and she actually convinced her senator to bring it up in the Senate, which he wasn't going to do. So, Nicole, tell us all the things that you and your group worked on with this bill.
I talked to uh, Senator Scoof and Senator Doug Campbell, and I talked to some of the House members, and I told them about my story that people with disabilities mostly want to work full time and keep working, and they see that I would like to work more.
Yeah, and you and Nicole started a group of self-advocates in the Clear Lake, Mason City area who are very active, and apparently they're so active and so convincing that Senator Dennis Guth introduced the Medicaid for Employed People with Disabilities limit elimination uh, last year in the Senate. He said in a committee meeting, he said, "I'm doing this because of my constituents. I really don't know that much about it, but I'm doing it because my constituents want it." And so that was quite a statement because you don't hear that a lot. But then the more that people started talking to him, other advocates, and he also has a family member who would be affected potentially by this, um, then he really bought into the program. So Nicole is the one who really educated him and her group that she works with up there, and made the difference because
Yes.
yeah, because otherwise it would not have come up in the Senate at all, because they haven't wanted it for 3 years, because they're tight with their money. And they think it's going to cost a lot, but they're listening and they're listening more now. And that's really important. And it's because of advocates like you, Nicole. So,
Thank you. It's an honor.
yeah, we're going to have you keep up the good work too.
Yes.
And Marie, thank you for your comments again. We're taking those down. Good ideas. Okay. Marie is, uh, and Mandy too. Thank you. Marie is showing you guys up. If you're interested in making comment too, absolutely in the chat because we want to take all this down and put it into consideration. Okay, I'll keep calling and then we'll let time here at the end to get some more input. There were some other bills that related to employment, and actually more than these two, that were introduced and didn't get very far. But we've been working for several years now on getting more scholarship programs or scholarship money into programs that are used for post-secondary education for students with disabilities that where the programs are focused on independent living and employment training. And they're called comprehensive transition programs. Um, we, we've asked, I'm not going to say we've asked, but a legislator has introduced this for the past at least 5 years, for an appropriation, a very small appropriation, to provide grants for students to go through these programs. And again, it's because it's extra money, it keeps getting turned down by the Senate. It has passed the House. So the alternative may be for this kind of program or request to go through voc rehab, which usually funds programs like this for students who are going into post-secondary work, but their goal is obviously employment. It just gives them some extra training after high school that is not available, and it's not a full college program because most people would not be eligible or be able to go through a full or community college program. So it's kind of an in-between program, but they're expensive and and there's not a lot of assistance for them because voc rehab does not have the money to support them. So this extra fund was created as a proposal to the legislature to get more students into these programs, and it keeps dying in the Senate. So there will be a new approach to this again this year. We're not sure which way it will go. And then the Senate file here that was introduced about voc rehab being used as a work search activity actually passed a Senate committee and then didn't go anywhere again. So it stayed alive for a while, and got again we had to do some education around what that meant. And it seems like such a obvious thing that would be allowed, and it's not. But one thing that is causing a lot of concern and headache is what's going on here with bullet number 3 about the new Medicaid work requirements. So both at the federal level and Iowa passed work requirements, well, not this past year, but the year before, and then pulled back on them because the federal government passed them in the one big beautiful bill. And so the Medicaid work requirements are causing the state to have to basically put together a new program to track people who are on Medicaid and are able to work. And able to work is a definition that's being difficult to understand, and is requiring some new rules and new policies for the state to implement. And because it's been so difficult to implement and from what the federal government is asking for, 25, and it might be 26 now, states have sued to either halt the requirements for going into implementation, or to eliminate them. And actually, most of them started on July 31st. So this, though, is causing us to rethink. Now we're kind of having to backtrack a little bit and think about what work requirements mean, and how Iowa may address this so that it's not costing the state money, but actually could be saving the state money by having people. The way it'll save the state money is people will have to drop off Medicaid because they can't do the work requirements. Um, so it's a conundrum in many ways, because we're on one hand we're trying to help people with disabilities get work and eliminate limits that keep them from working, but then we have, on the other hand, a requirement for work for anybody who is in the Medicaid program, and to meet a lot of new eligibility standards that are for people who may not be able to work, because they're either caring for a person with another person with disabilities at home, or they're frail, medically frail. That definition has not been clarified enough, or there's some other definitions about what is community engagement that is still unclear. So, for example, the requirement is to work 80 hours or being community engaged for 80 hours a month. And so that what's not clear is, if you're in a position where your hours are flexible and, it's based on what your employer is giving you for hours, what if you're down to 79 hours in 1 month? What does that mean? And those rules have not been released yet. So, some new things to think about there. Any comments or ideas anyone would like to share? Hey, Wendy, I'm going to let you take over.
Okay, thanks. So, one of the things and how we kind of started conversations in the DD Council too is the discussion prompt in this example. So it's something where you can come on here and kind of talk through this. You can do it in the chat or take a screenshot or something like that and think about it and then go through this process, and email it to Carlin, please, with this, because many times when we're up at the Capitol talking, the thing that we hear the most is, yes, we hear all the problems, but what are the solutions? We hear that a certain program needs more money, but where is that money going to come from? And so this is how we've kind of gone through the discussion prompt. And a little example is, okay, so what is the problem that we're seeing when we're talking about employment today is there are too many barriers for Iowans with disabilities who want to work. And so then even being, that's, you see how it's very broad in general, right? So be specific. What are the actual barriers? And, in the chat, we've had our session last week, we talked a lot about transportation also. But what are the additional barriers? And we do now have, with the new work requirements and all of that, it poses some questions. So get really down into the granular of what are the barriers, and then what are some solutions that you know of. Maybe it is programs that are already in the state that, if they could be enhanced, if they could be somewhat brought to more areas, or maybe there's other things that other states are doing that we could bring into Iowa. I frequently go and look at other bills in other states and what are they doing to solve this problem? Because if the legislation is written in one state, it's easier to kind of bring it over and bring an example. So, what is the actual solution? Again, being specific. So, one of the ideas that Carlin had mentioned to before is incentivizing employers. Okay. With tax breaks or a variety of different things for those who do hire individuals with disabilities. And then providing the stories. So, who do you know that, and maybe it's yourself or about your child, but share the stories of people not getting the jobs or not applying because they will lose their health care. So, we need to gather a bunch of stories and then create the facts, right? So, what are the costs and how could the costs be offset with revenue coming into the state in different ways? Because again, everything we hear is like, there's just not money in the budget, or where are we going to take it from? And so, if we are able to create revenue generating ideas, then it's easier to get someone to listen to us. So, with that, is there anybody who kind of wants to talk through this or has some ideas? I'll throw virtual Scooby snacks your way if you talk up now. Or does anybody have, a specific barrier that maybe we haven't put in the chat or maybe we haven't talked about that you can think of? I think, did I see? Can't keep up with it.
Yeah, we're getting good stuff in the chat. So
You can.
who's ever comfortable adding to the chat, it's great.
We might also want to put something in there about the job search process itself being incredibly inaccessible. Like, it's inaccessible for neurotypical people who are able-bodied. Especially now that like AI is just going to discard whatever you put in there before a human being sees it. And that's not a thing that, like, we don't have the time and energy to spend 3 months getting one interview.
Yeah, I think that's a great example of a problem that hasn't been brought up, right? The job search interview process is completely inaccessible. What's even a bigger problem with that, as I hear you, Marie, is like the AI bots are, taking out resumes before you can even get to a human. Okay, so do you, Marie, or any of us have any ideas? Like, what are some potential solutions for that? Of making the job search process more accessible and or not getting booted out by the AI bots. Anybody have any ideas? It's a good one and a tough one.
We can use some AI, not all.
Yeah, some sort of AI. I mean, helping those of us who use it in a variety of different ways, but like use AI to help with the process or teaching individuals with disabilities
Or with
or uh-huh.
or with something that you can with something
Yeah,
like you can with and they can help you with too.
they can help you with it. Yeah.
Yeah.
Yeah. Someone says flip the AI problem, ask what will help me with an interview as it scans the application process.
Good.
Um, Ooh, I like that one too. I just saw another one come in. So it's difficult to find employers and service providers who are willing and able to think outside of the box, taking tickets, bagging groceries. Need more programs that support individuals with significant needs. There are some really great programs out there who help train employers and help them to think outside the box. Can we get more organizations working hand in hand with employers to help them think outside the box? That'd be great.
That's how I found a job.
That's how you got a job?
Yep.
Fantastic.
I had a job coach.
Sorry, it's cutting in and out for me.
Oh,
I can't always hear you if I'm like this, but you had a job coach. Is that what you said?
yes, I did.
Yeah,
It,
yeah. And
it,
so I also think like if some of the programs that are already in the state, are too busy or too full, who else can help fill some of that? What other partnerships can be created to help employers with that? So good. Anybody have revenue generating ideas? Ooh, I just saw old school. I like that word. Is there any appetite among employers to go back a little old school and have a career fair or a reverse career fair where you're not applying through an AI tool? Yes. I know the ARC and a couple of other organizations are looking at having a reverse job fair. I think sometime, I was going to say in the spring, but that's already passed. So, yeah, and being more creative in those ways. And yes, going back to old school where we have human interactions and we talk to people. It's a novel idea now, huh? Um, but yeah, Project Search, it's a fantastic program. Um, yeah. And notice not all of these things are things necessarily that the government has to do or the state has to do, but looking at how we can involve other organizations or have organizations working together to make these things happen and help too.
you can find somebody who you know in your community.
Find somebody who you know in your community to help.
Yeah.
Yeah. Sorry,
And actually,
I was like, go ahead. I'm like, I asked a question about increasing revenue and then I jumped to something else. So sorry. Go ahead, Carlin.
no, that was good. And actually, the Project Search programs several got defunded last year. The ones that were had grants from the um,
Mm.
trying to remember which department, but anyway, because they were wanting them to be more community supported instead of State Department supported. So yeah, it's a good idea, but it's a concern that funding was cut off before we could keep those programs going without additional outside funding. And we know that Project Search works.
Disability specific internship programs. Um,
Yes,
yeah,
thank you, Daniel.
I think these are great. So yeah, any increasing revenue ideas anybody can have up? Sometimes it's just hard. I know there's a lot of data, and someone on this call probably knows that there's a lot of data on the impact of individuals with disabilities in the workplace. I was thinking a hand was going to raise there. Yeah, thank you, Daniel.
Yeah.
Um,
Sorry, this is Daniel. I had a question before I responded to yours. When you
uh-huh.
say uh, bringing in revenue, are you meaning specifically like the state of Iowa bringing external revenue in, or are you thinking of revenue to a program? What level of revenue are you talking about?
Um, yes, and both, and I'll explain. So, like, one of those, will say you need to just throw this out there, like you need to fund voc rehab more.
Hmm.
And then the question comes like, well, where does that money come from? Or if for instance, like they would one of the things if we would ask for more money for Project Search, where's that money coming from? So many times as we go to the legislators, we share a problem. The solution is more funding, but where does that funding come from? And how does it come into the state? And or how does it come to the organization? So that's why I said a yes and sorry.
Hmm. So this is still Daniel thinking out loud now since I put myself on the spot. Um, I mean, I don't think that this is not an answer that I've gotten a lot of traction with giving, but I do think there's an argument at the state level that what might be an initial increase in expenditure of these programs 5, 7, 10 years from now will end up saving or netting the state money. The problem is no one wants to be the elected official who raises costs today, even if it saves money when your term is over.
Mhm.
But it, increasing employment outcomes of disabled people in the long run does save the state money in terms of people working their way out of benefits, contributing income tax. So I think if you could show long run economic data, you again, I haven't gotten a lot of bites on this worm, but I think it's one that you can put out there that if we think long term and not just this session, that there is money to be saved. On a more programmatic basis, I was thinking of things like the ideas I put in the chat around like a reverse career fair or an internship program are often things that corporations may be interested in sponsoring or right the such and such disability internship program brought to you by whatever company. And so some of those programs can bring in, at least smaller level self-sustaining, but that's a completely different level than statewide uh,
Right.
revenue. Like you're not going to fund a statewide VR program on that model, but you can probably find a couple sponsors regionally or statewide that would say the career fair brought to you by this organization or right presenting sponsor is this coffee and breakfast brought to you by X grocery store and uh job I don't know. Like you know what I mean? You can kind of carve out some of the sponsorship and bring in money for those things.
Yeah, I love it. Going back to the long-term data, I'm assuming the answer is yes, but I don't want to assume. Is that data out there?
I actually don't know that the answer to that is yes.
Okay. I was
Um,
curious.
I'm not sure. I mean, this is not a conversation unique to me. I hear other people talking about these points,
Mhm.
uh, but I don't know that I've seen a solid data set nationally or even state level that proves my theory. You probably need someone with a little more economics background to run this, but it- it's a hypothesis or an assumption that I'm running off of right now.
Yeah, it makes logical sense. So I love it. And then just being able to find somebody to help back it up so that there is it's not us advocates saying it, right? And then oh, if we can show someone else is backing it up, then they tend to listen a little more.
Yeah,
So thanks for the conversation, Daniel.
sure.
Yeah, and Daniel's being humble because he's also helping us gather data through, an alliance with other organizations where we're trying to put together the pieces to tell a better story to legislators. So there is a lot of data that we would like to have and just don't have our hands on yet. So we're trying to figure out ways to get it or find it and also compare what other states have worked on as far as programs such as income and asset limits to keep people on Medicaid and have them be able to work. Um, Several states have done different things, that we're looking at to see if there's, again, something that we think would be an option for Iowa that our lawmakers might consider. So if you know of any examples or know what's, have heard about anything from other states, please feel free to pass things on to us.
I'm gonna jump in here real quick. I know I've been reached out to by the state of Minnesota, and at the time they were having the same struggles, if not more, and looking for people from Iowa to talk to because they felt our programs were working very well. Now, that being said, with current administration, I think that's not, I think every state's going to have a problem. But my biggest kind of a little detour, we need to get this out more. We need to bring it into the forefront because I think a lot of things are hidden. They don't want to put money towards it. They'd rather put money towards something else. But if we get this out there so the public can see it, it's a big deal. It's a big problem. We might get more support. And I'm not sure how to do that exactly, but I mean, I've looked at different things. My son is involved with Goodwill. They provide a lot of services that many people don't know about because it's just not known. And I think doing with employment and trying to get the in to the office to the interview, it's hard because we don't know what kind of businesses are going to look at that and employ that. If we get this more out in the forefront as saying, I don't like the word problem, but we need more public support and we need more public understanding. I don't think that's being done. Um, Legislators, I think, just look for the bottom line. They don't want to bring things forward other than it's going to cost this or it's going to cost that. So it makes it even harder for us as parents and advocates and people who work in this area. Very difficult. Yes, I'd be interested to see what other states do. I'm not sure what kind of data is being collected and how that would be relatable to legislators. I just going through a leadership class, talking to a couple legislators, they said they had no idea. Nobody really talked to them or really brought it to their attention. So I know that's something we need to push, but I think public knowledge, no matter how we can get it, I think would be a wonderful asset.
It's a good point, Mandy. Thank you. I would just suggest too, if you hear of other, families who've moved to other states who have gotten good services, and I'll just give an example. I know nobody wants to hear about anything about California being good, but I had a friend whose son moved to California who, was has disabilities and was looking for employment, and there was no wait for services, there was no wait for a job coach. He was employed within a few months, and that would be impossible here, and they knew it too, that his ability to even be employed here with his looking for the same kind of job would have taken much, much longer. So I have a little bit of information about those services. They do function much differently than Iowa, but and they have a lot more people and taking a lot more tax dollars, that they might be able to fund these kind of programs. But they also make employing people with disabilities a priority for their state, and that is, that doesn't seem to be the way things work here. And so changing the narrative, changing the focus. I think we've made some headway in the last couple years, and even Nicole with her work on her senator, and more education about and just getting more people to talk to their people with disabilities who want to work, to talk to their legislators and let them understand what the barriers are. The other side is employers. We really need more employers to be willing to hire people and to put in some extra effort to make employment of people with disabilities a priority for them also. But we need to make it easy for them too. We're getting close to time. Any final thoughts here? Um, your comments and suggestions are very helpful, and we really appreciate it. And just, we want to hear where everybody is at too. And so hearing your stories and what you're going through is very helpful. Even if you don't have, we none of us have brilliant ideas right now. That's why we're all on this call. So that's why we have to talk more and understand what we're thinking, what you're all going through, and what you're thinking, and so we can pull it all together. And it's hard, but that's why we're all in this together. And
I
uh,
asked, went to college.
did you say you went to college, Nicole?
I did, yeah.
Yes, I know. Was that NIAC?
No. LH Community College in Innisford.
Okay,
They had a program called SAVE program. Local rehab paid half of it.
good. Yes, that is one of
So
the programs that's not. It's
yeah.
not. Yeah, it's kind of a comprehensive transition program, but a little different. And so, yeah, voc rehab has kind of different categories of what they'll pay for and how much. And that's great that you were able to get it paid for that much. So,
Yes, and I'm using my not degree, my certificate in childcare right now.
yeah. And how many hours a week do you work, Nicole?
I work Monday, Wednesday, and Fridays, 8:30 to noon.
Good. Thanks for sharing your story.
You're welcome. And the staff is good, and the my boss is great.
That's good. We need those kind of success stories to hear too, so we can share success so other employers can, or so they can be an example for other employers.
If I have trouble, they will help me.
You're a good example. We need to get your story in our book next year. We showed a couple of those slides, and I know we're over time here, and now I can't get back to my slide deck. I've had this problem all day today. My computer had a Monday. Um, but yes, we have used stories of Iowans who have had different experiences in employment. And some of these people you probably, if you're following us, you've probably seen them several times because we tend to grab onto a story and use it. And Zach and Alex have been very outspoken about their um, experiences and have worked really hard on the Work Without Worry bill. And so we could use some news stories too to add to these. These have been very helpful, and these people have all been um, very good advocates, as well as Nicole. And so,
Thank you.
yes, you're welcome. Send more people our way.
And
And
it's
you're
running
willing,
office.
right. And if you're willing to tell your story, then we also want to hear that.
I
So
will.
thank you. Did you say you're running for office, Nicole? Is that your next adventure?
I said Zach is running.
Zach is, yeah. You're up next.
Hope I want to be.
Cool. Well, thanks everybody for joining, and keep in touch, and hope to see you on another call
Yeah.
or
Thank
get
you
some
so
get
much.
some emails from you. Thank you, Nicole.
Welcome. Bye.
Bye.